Hi, I'm Ellen and welcome to Mentally Detoured. Before I start talking about the 3 types of depression that I'm covering today, I'd like to pose a question. Do you ever think of mental illnesses as being fatal? 90% of those that kill themselves have a mental illness, diagnosed or undiagnosed. 60% of those have some form of depression. That's why it's so important to know the signs of depression and important to know the warning signs of suicide. This won't be the last time that I talk about the warning signs, but here you go. By the way, I've taken them from the American Foundation for Suicide Prevention, a leading organization in the fight against suicide. People that kill themselves often exhibit warning signs, and yet it can happen that when a suicide has occurred, those left behind say they never saw it coming. That's why I'm preaching the more you know. Remember, suicide does not discriminate. Okay, 3 main things to pay attention to if someone you suspect is thinking about killing themselves. What they are saying, how they are behaving, and what their mood is. What are they saying? Are they talking about killing themselves, having no reason to live, being a burden to others, unbearable pain, or feeling trapped? With behavior, have they developed a new behavior or increased doing another? And has there been a recent painful event or loss? Red flag behaviors include increased alcohol or drug use, looking for a way to kill themselves or making a plan, acting recklessly, withdrawing from activities and isolating from family or friends, sleeping too much or too little, aggression, saying goodbye to family and friends, and giving away prized possessions. In the mood department, those considering suicide often display one or more of these moods: depression, rage, loss of interest, irritability, humiliation, and anxiety. The more warning signs you see, the greater the risk for a suicide attempt. Anyone can call the National Suicide Prevention Lifeline, 1-800-273-8255. 2 of the 3 subtypes of depression discussed in this video have a greater risk of suicide than other types, though anyone with any kind of depression has a risk. Starting with atypical depression, this is a subtype that has the same depressed mood and lack of interest that major depressive disorder has, but also has some very specific symptoms. The one that must be present for a diagnosis is mood reactivity, which is basically a person's mood brightens up when positive events happen. Other signifiers are weight gain and sleeping too much, at least more than 10 hours a day, a perception of interpersonal rejection, which they tend to have even when other depressive symptoms have been relieved, and a heavy sensation feeling in their arms and legs. Atypical depression is not unusual. More women than men are diagnosed with it, and there's often an earlier onset and can have a higher risk of suicide, as mentioned before. Other complications are obesity, substance abuse, relationship and work problems. There's also a high co-occurrence of anxiety disorders and social phobias. Treatment is the same as for major depressive disorder, with medications, psychotherapy, and lifestyle changes. Psychotic depression is also called major depressive disorder with psychotic features or psychosis. Psychosis is loss of touch with reality and can include hallucinations, seeing or hearing things that aren't there, or delusions, false beliefs about who one is or what is taking place. This is a very serious subtype of depression and should be treated immediately. Patients are treated with antidepressants and antipsychotics and may be hospitalized, placed on suicide watch. The antipsychotic medications may only be needed for a short time, and once relieved, the depression symptoms are more likely to return than the psychosis. Psychotic depression is far less common than depression without psychotic features, but the risk for suicide is greater. Do you think it's depressing to learn about depression? I think it can be, but if we don't know, then how can we empathize with those who suffer? There is a form of depression that almost everyone has experienced. Situational or reactive depression is your emotional response to a traumatic event in your life, normal grieving. The thing to remember is that while grief and depression share some of the same symptoms, there are some distinctions. With grief, painful feelings come in waves mixed with positive memories, while a depressive mood disorder is almost constantly negative. With grief, self-esteem is usually preserved, In depression, feelings of worthlessness and low self-esteem are common. A normal grieving period, which is different for everyone following a traumatic event or loss, can trigger a depressive episode. It is important to note any changes in mood or behavior that don't seem to be improving over time or are worsening and seek professional help. Plato teaches us to be kind, for everyone you meet is fighting a hard battle. Until next time.